Hi, I'm Jeff Terrell, Program Director here at Fenton Fitness and Athletic Center, and today we're going to talk about squat mechanics and ankle mobility and how those two interplay. I was talking to one of our clients who's a football coach at Fenton High School, and we were talking about how a lot of the athletes that they see squat tend to have their heels elevate when they squat, and that's pretty common with athletes and with adults. You'll see people squat down as they come down that bottom position, their heels want to pick up off the ground. And he was asking why that happens. There's three main reasons. One can be an ankle mobility issue, the other can be a hip mobility issue, and the third would be a core strength and stability issue. So today we're going to address the ankles, how to assess to see if the ankles move adequately, and what to do if they don't move well. And then next week we'll cover hips, and then we'll cover the core after that. So quick, simple assessment. We're going to take our fist, we're going to place that closed fist next to the wall. We're going to line up our toe without a shoe on, because a shoe can mask that ankle mobility by elevating the heel artificially. And that gap between our foot and the wall, from there in a half kneeling position, you're just going to see if we can get our knee to touch the wall without the heel coming off the ground. If we can do that, then we have good ankle mobility. If as we drive that knee forward, our heel wants to elevate in order to get to the wall, that shows us our ankles do not move adequately, and then we want to address that. So the three main things that we use to address ankle mobility: lacrosse ball, baseball, golf ball, something hard and dense and small under the middle of your foot. You're going to roll out the arch of your foot, the heel of your foot, and the ball of your foot. And you're just going to try to find any tender spots anywhere that hurts. Usually, anywhere from 15 to 30 rolls, and spending time on those areas that are hurt and are sensitive. The other thing we can do, massage stick, soft tissue work. So if you don't have a massage stick, you can always use a rolling pin at home. Back of the calf, all the way down to the Achilles tendon. Try to hit all sides of that calf. So side, middle, the other side. And again, as aggressively as you can tolerate. And about 15 to 20 rolls there should do the trick. The third and final thing would be a calf stretch. So the one that I like to use the most is a push-up position calf stretch. So you're just going to put one foot over the back of the other foot, try to drive the heel flat, and you're just going to hold that for time, about 30 to 60 seconds, or 5 to 10 nice, deep, slow breaths. If your ankles don't move well, you probably want to do those things at least 4 to 5 times a week. Do them before workouts, especially if you're squatting. In the meantime, when you are doing your squat work, you can elevate your heels by placing a small plate, a 5 or 10 pound plate under your heels to help give you some stability while squatting.